Hello everyone, I'm Derek Yao. It's my pleasure to be here to give you a brief introduction of TruCare insulin pump. TruCare insulin pump is produced by Apex Medical. The model of this pump is TruCare 1. TruCare 1 pump uses standard loop connection, which is very widely used in all kinds of medical infusion set. First, let's look at the appearance of this pump. We have LED screen here to show the menu, the status of the pump, and other information. And here we have 4 buttons. From left to right is up, down, ESC, and ACT. The up button is used for scrolling up through the menu, or change the number when you are setting your bolus or basal rate. And also you can see a B here. That means you can simply go to the bolus menu just by pressing this button from home screen. The down button is used for scrolling down through the menu, or change the number when you are setting your bolus or basal rate. Also you can see a light symbol here. If you find it hard to read the screen during night, you can keep pressing this button for 2 seconds from home screen. Then the backlight will be turned on. Next is ESC button. You can use this button to go back to the previous menu or cancel things you're doing. The last is ACT. We use it to confirm things you are doing. And this is the battery compartment of the pump. In this part of our insulin pump, we put in a AAA alkaline battery. And please note that you can only use a new battery to start the pump, or it will not work properly. And we will also recommend you to use the brand Energizer. If you want to open the compartment, you can use a comb to turn it counterclockwise, like this. If you want to insert a battery, please remember that positive up and negative down. Then tighten the cap with your comb. Turn it clockwise, like this. And this part is the reservoir compartment. Here you can put in a 3 mm reservoir which contains your insulin. This is a reservoir cap. I will talk about it, how to use it, during the introduction of infusion set. From this side, you can see a transparent window, from where you can check how much insulin is left. Then, let's look at the back of the pump. We have a label here showing the serial number and the manufacturing information of the pump. Before you start using insulin pump, you need to prepare the following things. First, wash your hands and prepare insulin pump and the insulin. Please remember that you can only use U100 rapid-acting or short-acting insulin. The introducer, the reservoir, the infusion set, alcohol swab, and the battery. Do not insert infusion set until instructed by professional healthcare. And always check your blood sugar 2 to 3 hours at each time you set or change the infusion set to confirm whether the infusion set is inserted properly and if your insulin has been delivered into your body. And also please note that do not insert or change infusion set before you go to bed. Take out insulin from refrigerator half an hour before use to reduce bubbles. And swab the bottle cap with alcohol swab. Then take out the reservoir from package. Remove the protective cap and draw back the push rod. Then insert the needle into the bottle. Push into the air. Then make upside down. Gently release the push rod and insulin will come into reservoir automatically. And when you see air here, you can push it back into the bottle. Then draw back the push rod again. Then take out the needle. When you see bubbles here, just gently kick the reservoir. And push it out. Then put back the protective cap and remove the push rod by turning it counterclockwise. Every time you use a new reservoir or change the reservoir, you need to do motor rewind firstly. How to do this? First, select Prime from main menu and press ACT. Move it to Rewind and press ACT. And press ACT again. Now the motor is rewinding. You can see the push rod is coming back. When the rewind is completed, the pump will beep to remind you. Then we can insert the reservoir. Remove the cap. And remove the needle from the reservoir. Put in the reservoir and put back the cap. And take out infusion set. Connect it like this. After you connect infusion set with the reservoir, press ACT to continue. And hold down the ACT button. Now the priming started. Now we need to observe the needle tip of the infusion set. When you see the drop out of the needle tip, release the button, and the pump will also stop automatically when the insulin comes out from the needle tip. Clean the infusion site with alcohol swab from inside to outside. Then insert the infusion set. Please make sure that the needle tip is vertical with the skin. Then make a stick attached to the skin well. Make sure the time and date of your insulin pump is right before you start setting. How to set time and date? First, select Utilities from main menu. Then press ACT. Move to time and date. Now the pump will show the current time. If you want to change it, press ACT. Then use up and down button to change the number of year. Then press ACT to set months. Use up and down button to change the number. Then press ACT to set the date. Then press ACT to set the hour, the minute, and the second. An accurate basal rate is very important to maintain your blood glucose level when you are not eating or when you are sleeping. Let's use the example on the paper to show you how to set the basal rate. Select basal from main menu. Press ACT. Move to Set at Basal. Press ACT. The first basal rate always starts from midnight. Use up and down button to change the first basal rate. Then press ACT. Now set the start time of second basal rate, which is also the end time of the first basal rate. And press ACT to set second basal rate. Now the start time of the third basal rate. And the third basal rate. The start time of the fourth basal rate. And the fourth basal rate. The start time of the fifth basal rate. And the fifth basal rate. When you finish the last basal rate, just press ACT. The pump will show the information of the base rate you just set. And also, you can move to base review to check if there is some mistake. Bolus is used for covering meal carbohydrate or correct high blood glucose. There are two ways to set a bolus. The first way is press this button from home screen. And second way is choose bolus from main menu and choose set bolus. Then use up and down button to set the dose of insulin according to your food carbohydrate and your blood sugar level. Then press ACT. The bolus delivery start. After bolus is completed, the pump will beep to remind you. If you want to stop your pump for some reason, select Suspend from a menu and press ACT to stop the pump. And if you want to restart your pump, you should press ACT from home screen. And screen will show you that pump is stopped. Then press ACT again. You can see that the word resume is flashing. And press ACT to restart the pump. Please remember that the base rate starts again, but bolus is cancelled when you suspend your pump.